Welcome back to another edition of Health Hack as I round out the week talking about heart health. Another aspect of bringing your heart disease back into being heart health, because heart disease doesn't have to be a life sentence, is exercising. Exercise is good for the heart. The heart is a muscle and it likes exercise. However, you do have to be careful and start where you're at. You're not going to jump right in and do a 1-hour cardio workout if you haven't done a cardio workout for the last 6 months or even for the last month. So when it comes to exercising, as I've said previously, most people in today's world are not moving their bodies enough. Back in the day, humans were walking 15 miles per day, and now most people are not walking 15 miles in a week. And so you just want to start off with, where are you at? Start off with going 1,000 steps a day and build up to 5,000 over the course of a week, and then build up to 10,000 maybe over the course of the next 3 weeks to get to 10,000 steps a day. And from there, then you can start to add on and add in some aerobics workouts. Maybe you want to start off with just 15-minute workouts and gradually build up to 30-minute workouts and 60-minute workouts. Aerobic workouts are very good for the heart. They help you to sleep better. They do help with lowering stress. In fact, they reduce the risk of Alzheimer's and dementia. You look better, your body starts to change, you get into better shape, you feel like you have more energy. So there's so many benefits to this. However, you need to start off slowly. And the other thing in terms of starting off is, depending where you're at, you may need to first talk to your doctor to get approval to start any kind of exercise routine, just to make sure that it's safe for you and your heart. So let's just talk about blood pressure levels so that you know where you're at and where you might be needing to talk to your doctor first. So a blood pressure of 120/80 is considered normal. And if you're not moving enough and you're at a normal level, you can just start moving on your own. Start with, like I said, 1,000 steps a day and slowly build that up. If your blood pressure is now at a level around 140/90, you're starting to get into a state of hypertension. And this is when you do want to seek support in changing your diet, in lowering your stress levels, in potentially supporting your diet with some supplements that will support your heart health. And so this is where you want to start seeking help so that you can start to reverse the path that you're on and not end up with a diagnosis of heart disease. Anywhere over 150/100 is now considered high blood pressure, and you definitely need support, and you're going to want to be working with a doctor to ensure that you are keeping your heart in a safe place and lowering the risk of any kind of heart attack, while again changing your diet, lowering your stress, and starting to exercise. But now you're going to be wanting to ask your doctor, is it safe for me to be exercising, and where do I start? And if you're up at 180/110, that's very poorly controlled blood pressure. And again, if you're not already getting support, you definitely need to be getting support. If you are getting support, then continue with that support. And again, work on your lifestyle factors as well, because even the medications are having a hard time controlling your blood pressure. So seek the support you need. Exercise is a big piece of reversing your high blood pressure and your risk of heart disease. It absolutely can be done. Just don't try to do it on your own. Get the experts that can help you so that you can regain your heart health and remove that risk of sudden death of heart attack, which unfortunately is killing 1 in 3 people in North America. Don't let it be you. Reach out if you'd like to learn more and have more support around this.